Colorado Care is a universal health care system that will pay the medical expenses of all of the residents of Colorado. It is financed through new taxes, but it saves us the huge sums that we spend on medical insurance, deductibles, hospitalization, drugs, and more. Lately, the opponents of Colorado Care have been using the oldest trick in the book. They're trying to scare us. Led by the group Coloradans for Coloradans, which is financed by health insurance companies, drug companies, and large hospital chains, they're running ads with half-truths and misinformation that have one purpose only, to make you afraid of Colorado Care. Well, I'm here to tell you, you should be scared. You should be very, very scared, but not of Colorado Care. You should be afraid of the current system, which generates billions of dollars in profits for insurance companies and millions of dollars in bonuses for their executives, while forcing the rest of us to pay ever larger premiums or to just go without health insurance. You should be scared of the fact that while these companies generate billions in profits, 20,000 Americans will die this year and every year, not because there's not a cure for them, but because they cannot pay for the health care that would save their lives. And you should be very scared of the fact that 700,000 Americans will declare medical bankruptcy this year, losing just about everything they have because they got sick. You may have read recently that individual policy premiums will go up 20% next year in Colorado. 20% in 1 year. You may also know that we Americans pay twice as much as citizens in other developed countries, even though we don't live longer, we're not healthier, and our infant mortality rate is the worst among developed countries. The current system is slowly but surely, and perhaps not all that slowly, pushing us into a position where only people who are well off will be able to afford medical insurance. We simply can't tolerate these price increases year after year after year. So if we're going to be scared of something, we should be scared of doing nothing and letting the current system remain in place. When you hear the Colorado Care opponents spreading their lies and misinformation, make sure you know the truth. The Board of Trustees cannot raise the tax rate without a vote of the people. Read the amendment. The Board of Trustees will not decide what's covered and what's not covered, since the amendment clearly outlines the services that Colorado Care must cover. The amendment also states that the board must establish policies and procedures to cover us when we're temporarily out of the state. Colorado Care does not levy taxes on every dollar of retirement income. Read the amendment. Doctors will not leave the state, small businesses will not collapse, residents of other states will not be allowed to move to Colorado to get free health care. So be afraid, be very afraid. But there is something you can do about it. Vote yes for 69. We Coloradans will take control of our health care payments from the big companies and establish a cooperative whose only mission is to make sure all Coloradans get the health care they need. Vote yes for Amendment 69, Colorado Care.
I worked in the insurance industry for 31 years. I am not here today as an insurance agent, but as a fellow Coloradan. Amendment 69 is not good for you, and it's not good for Colorado. It is risky, it is uncertain, and it is unaffordable. Coloradans should not be guinea pigs. We should not have to risk our health care, our income, and our future, economic future, for such uncertainties. This amendment would put Colorado in the highest income tax in the nation with no guarantees of good coverage. Amendment 69 would cost taxpayers $25 billion every year, which is an increase to Colorado's current $27 billion budget. Every Coloradoan would pay a 10% income tax increase, 10% increase on their income taxes. This includes your retirement income and your Social Security income. Amendment 69 is exempt from the Tabor law, so these expenses will just go up and up every year. On top of this, our small business owners would suffer the most. This plan calls for an additional 10% payroll tax. 2/3 of this comes from our employers of small businesses and sole proprietors. 1/3 from each Colorado employee. This is a big deterrent to do business in Colorado. Because government healthcare programs reimburse providers at substantially lower levels than private healthcare insurance, our current and future medical providers will go elsewhere. Our hospitals and clinics would not survive this. Amendment 69 offers no guarantee that Colorado Care will improve patient care, expand access to providers, or reduce health care costs. If you live in Colorado, you must live in Colorado for 1 year to be eligible for care. There are also no provisions in the amendment for when you go out of state or for our residents that live here seasonally. Colorado Care would be run by a 21-member board of trustees with no qualifications, no health industry experience, and with limited accountability. The board would be responsible for running a new $36 billion entity and for making decisions on what rates they pay our providers and for what is medically necessary or not. The bottom line, higher taxes, lack of accountability, and no guarantees about our coverage. There are just too many unknowns surrounding this amendment. Please vote no for Amendment 69. It is bad for Colorado. It is bad for you. Keep government bureaucracy out of our healthcare system. Thank you.
Great. All right, thank you. So now I am going to ask you guys a question. You'll have 3 minutes to respond. We're going to start with opponents. My question is, an independent study suggested that Colorado Care would be financially unstable after just a few years of implementation. Do you agree with this study from Colorado Health Institute? Opponents.
Yes, I do agree that it would be very unstable. Give Vermont as an example. They tried it, it got passed, and after 3 years, they had to discontinue it because it was costing them $10 billion more than what their projections were. If the medical costs keep going up, then people would have to pay twice as much. Taxes, they're just unlimited. And because of the Tabor exemption, these costs can just keep going up and up for our taxes.
Great. Proponents?
Okay. The CHI analysis is pretty interesting because they looked at the same numbers that the Colorado Care people looked at, and they came to a different conclusion. And it's basically because of two things. Number one, they said, for whatever reason they thought, that the federal government would start to pull Medicaid funds away from the state if we did this. We at Colorado Care don't understand that at all. It doesn't seem like that would make any sense for the federal government because that would basically drive Colorado Care out of business. They'd be right back where they started, having to pay Medicaid dollars. The second thing was that they said we couldn't hold the growth of health care costs down, even though we're only projecting 0.5% per year that we would hold it down. So there's a legitimate difference of opinion there in terms of what's what, although if their analysis says that our analysis in the very beginning is in fact correct, that we will in fact generate $25 billion worth of taxes, but we'll save ourselves $30 billion that we're spending right now out of pocket on medical expenses, and that's what I talked about earlier. So with the rounding, we save about $4.5 billion, and the CHI analysis said basically the same thing. Let's assume for a second that the CHI analysis is correct and that out in year 10, we're short money. And it starts before that, but in that final year 10, we're short 13.9%, which means the tax rate would have to go from 10% to 11.4%, not double, 11.4%, even in the worst case that CHI came up with. So if in fact medical expenses keep going up, we're going to pay for them one way or another, right? You're either going to pay more through your insurance or you're going to pay more through Colorado Care. But raising the tax rate from 10% to 11.4% is not at all the same thing as all of a sudden that we're going to have to double the taxes. So the CHI analysis, there's some disagreement with the Colorado Care people, but even if you take that analysis, and they're a nonpartisan, pretty well-respected group, Even if you take their analysis, that's worst case. We have to go from 10% to 11.4, which isn't exactly going to break us.
Great. So we're going to move to audience questions. I got a lot of them. There seems to be a lot of interest in this. Obviously won't be able to get to all of those. I'm sorry. We'll try to get through a couple of these here. In the sake of time, maybe try to keep your answers to 2 minutes at most. And if you could do shorter, that would be great. We could get through more questions. So this first question, and we will start with proponents on this one. Why is Colorado Care an unknown risk if the rest of the industrialized world has been able to successfully implement single-payer systems?
That's a very good question. We are the only developed country in the world that doesn't guarantee health care to their citizens. There's only one, us. Okay, all these other countries, somehow they're managed to do this. Are they smarter than we are? Well, probably not. Do they spend more than we do? No, they spend half as much as we do. So what's going on here? I mean, you say this can't possibly work, you know? But there's 40 or 50 developed countries out there that have systems. Some of them are different than the way they do it, but Canada's a good example. They actually have, I believe, 14 different systems. There's not a national system. Each one of their provinces and territories has their own system. Very similar to what we're proposing. And they have made this work for years and years. And I've talked to a bunch of Canadians. I've been working with some Canadians. And believe me, they like their healthcare system a whole lot better than we like ours.
Great. Opponents. You want me to
Same question?
Same question, yes.
Would you repeat, please?
Why is Colorado Care an unknown risk if the rest of the industrialized world has been able to successfully implement single-payer systems?
Thank you. For one reason, if our whole government, our whole United States would go on this system, it could work. But with only Colorado, we're creating an island where we can only get care here, and we wouldn't have our care outside of the state of Colorado. If you wanted to go to a specialist outside of the state of Colorado, you would not be able to do that. So I can see how it could possibly work if the whole country were to do this, like Canada, because they have a whole country to back up. You're not creating borders of care.
All right, let's get to another question here, and we're going to start with opponents on this one. I'm going to phrase this a little differently than it's read, since I'm reading this to the opponents. Do you feel that the proponents have considered and calculated the savings of no premiums, no deductibles, no copays, and the government subsidy in their figures of the increased taxes? And we should add that that tax is a 10% payroll tax.
Want me to start?
Yeah.
I don't think they have calculated that in properly, because $35 billion would only begin to start paying all of the expenses for every Coloradoan. There is a lot of people that are unemployed, so they would be unable to collect the tax from those people, but yet they still get the care. Every person in the state of Colorado would receive care, and we couldn't generate enough money to do that. It would just be too costly.
Just a quick, don't take this as offense, it's $25 billion, not $35 billion. So just to clarify that.
Well, with the money that the federal government
Fair
is
enough. Absolutely.
contributing.
To the proponents, have you considered and calculated the savings of no premiums, no deductibles, no copays, and the government subsidy in your figures of increased taxes?
Absolutely. This was not just thrown together. There was an economist, a healthcare economist at the University of Massachusetts, who vetted this program. And in fact, when Dr. Aguilar was here, Senator Aguilar was here a couple of weeks ago, she said they did this differently than Vermont did. They didn't just sit down and say, okay, we're going to pass a law for all these things we have to do, and then later on we'll figure out how much it's going to cost. They put together what they wanted to do, and they went to the legislative bodies that can do the kind of calculations. They said, what does the tax rate have to be in order to do this? And it turned out it was 10%. And they took it to an economist at the University of Massachusetts, and he vetted the numbers and said, yes, this will work. Then we just talked about the CHI analysis where they went through the same thing. So I'm not a healthcare economist, I can't tell you, but I know there's been at least 2 organizations that are in fact healthcare economists that have gone through this thing and said, yes, this works. So you look at it, we've got about 6% of the people that are not covered. So it's not like we've got 55% not covered that we've got to start covering. We just have to cover 6% more people in order to cover everybody. So the numbers are perfectly reasonable, they've been worked out, and you can't just say, oh, the numbers are all wrong, because the people who know have in fact gone through the numbers and said, yes, this is in fact correct. So it takes $25 billion of taxes, along with the money coming from the federal government, and we save the $30 billion that we're putting out right now for insurance. You don't have to buy insurance anymore. You don't have any deductibles. If you get sick, you don't have to come up with $5,000 before the insurance starts paying. So the numbers work. And I have not seen anything at all from our opponents that has any facts at all that tell us why the numbers don't work.
I think we should, do we have to move on to the... Oh, I have lots of questions. That's not the issue. The issue is how we do it on time. You want to keep... Okay, we'll keep going. Abortion rights groups have said that Colorado Care would unintentionally limit access to abortions in Colorado thanks to a constitutional conflict. Does this concern you? Proponents, why don't you start on that one?
There's a disagreement there about whether or not the newer amendment would in fact trump the older amendment that doesn't allow state funds to be used for abortions. You can understand that NARAL, which is a single issue organization that's only concerned about abortion access, would come up and say, well, this might not happen. And they're not saying it wouldn't happen, they're saying it might not, so they're not approving it. The one that really bothers me is Rocky Mountain Planned Parenthood, who's not supposed to be just an abortion organization. They're supposed to be a women's health care organization. They came out against Colorado Care, but they said the reason was because of the fact that we couldn't guarantee that elective abortions would be covered. Clearly, according to the amendment, medical abortions where there's rape, incest, or a threat to the life of the mother are in fact covered. It's elective abortions that are really the issue. My understanding is there's only about 1,200 of those in the whole state every year, and so somebody could easily raise private funds to cover that. It's not, it's a little tiny thing compared to all the really good things that we're going to do for people, and particularly for women's health. And so how they can just talk about abortion as being something that, oh, we're not going to go for this because it might not cover elective abortions. That's what they decided.
Opponents?
It does concern me that this may be an option that shuts off abortion options for women. I've read the amendment. There is nothing in the amendment that says one way or the other. It's all very undecisive. It's very vague in how they would pay for that. There's just so many uncertainties in the amendment that doesn't even, the only thing as far as what they will cover is the basics, the things that the Obamacare coverage mandates are in there. Other than that, it does not give any information about what coverages they will have.
I think we'll do one more question here before we go a little too over. I'm getting the same question over and over in a different way, so we're going to ask this one. There seems to be a lot of question about how this would work once you leave Colorado. I'm getting this question in the form of how it would affect college kids who are out of state, how it affects folks as they're traveling. So why don't we start with the opponents? I'm going to ask it this way. Is there legitimate concerns here that once a Coloradan leaves the state, that this could be a problem for them?
This is a big problem for Coloradoans. If you travel or live out of the state, like our winter people going to Arizona, Colorado Care would have to make arrangements with specific physicians to cover you out of the state. They would mandate the rate that they would pay those physicians. You would probably, I think at the last meeting with Senator Aguilar, she said she wasn't sure how that would work, but they are hoping that they would have at least urgent care and emergency care out of the state of Colorado. But if you wanted to go to Mayo Clinic or one of the big facilities for care for a disease that you have or for special treatment, you would not be able to do that unless Colorado Care makes special arrangements with a specific doctor, and they would govern the rate that they would pay that physician.